COVID isn't the only illness to be thinking about this fall. Flu season just around the corner, so now is the time to start scheduling an appointment to get your shot. Joining us now is medical editor Dr. Dave Hnida. And Dr. Dave, when is the best time to get a flu shot?
Well, the answer to that one is not too early, not too late. And you say, well, what the heck does that mean? It really is based on the vaccine itself. We know that the vaccine is effective for about 4 to 6 months. And flu season usually begins in the fall and extends out into the mid to latter part of spring. On the other hand, it takes about 2 weeks for the vaccine to kick in. So if we wind up having an early outbreak of flu, you do want to have it on board and have it be effective. So having said that, you're hearing a lot of time frames for people to be vaccinated. I think if you put a set date down, the date I would put down would be October 1st. October 1st gives you a little bit of leeway to get that vaccination done. And it's really important to get that vaccine done. It is recommended for those age 6 months and older. And it is something that we really do believe is an extremely effective thing in terms of preventing severe disease, including hospitalization and death. A lot of folks are saying, well, is this really worth it? Is it going to be a bad flu year? What's going on? Well, typically we take a look at what's going on in the Southern Hemisphere. We look at places like Australia, South America, and so forth. They are just getting through a very severe and an early arriving flu season. So I think that's the expectation for what we're going to get here in the United States. It's important to also understand that there are 3 main things when it comes to flu vaccinations. If you're vaccinating a child, typically for their first vaccine, they actually need 2. One is the original vaccine, and then they need a booster. And then from that point forward, they will only need 1 vaccination a year. If you're over the age of 65, we like you to get what's called it's kind of a turbocharged vaccine. It is a flu shot that is especially designed for older folks who have typically a weaker immune system, so it is a little bit extra protective. And then for those of us who really despise needles, there is a nasal flu vaccine that is approved basically for ages 2 to 49 if you're otherwise healthy. So if you want to avoid the stick and want to use a nasal vaccine instead, please talk to your doctor about that.
I'm always one of those that gets a little bit nervous with them, so that's interesting. Dr. Dave, speaking about shots, Pfizer has an updated COVID vaccine that's awaiting emergency use authorization from the FDA. Who's going to want to get this dose?
Well, it's interesting because it's not just Pfizer. Moderna just came out and said, hey, we've got one too. And so really what this is a set of what are called bivalent vaccines. They contain the original protection against the strain of COVID-19, as well as the variants BA4 and BA5. And BA5 is responsible for more than 90% of cases that are going on in the United States right now. I think you're going to see a huge push come out of the White House after Labor Day for these vaccines to be approved and given to folks and just really get them into arms for protection in what we are expecting to have when it comes to fall and winter, a surge in infections again. These are vaccines that really are intended for 12 and upward. And a lot of folks are saying, well, what happens if I've already been vaccinated or recently vaccinated or just had COVID? Should I be getting this vaccine? We think that if you have just gotten over a COVID a COVID infection, that you should probably hang on for about 2 to 3 months before you wind up getting this booster vaccine. So once again, if you've just recently had COVID, 2 to 3 months before you get this new booster that is coming out. If you've been otherwise recently vaccinated or gotten your booster, once again, we'd like you to wait about 2 to 3 months before you do get this new type of booster. The other thing to keep in mind is we're not so much worried about people who are getting this new type of bivalent vaccine, we really are still aiming for people who, number one, have never been vaccinated, as well as people who maybe did not get that booster shot, which is really intended for everybody, and particularly those people over the age of 50 who should really have 2 booster shots. So please go ahead and take a look and be open-minded when it comes to this new vaccination. Be available after Labor Day and should be very effective in protecting us as we go into the fall and winter.
Interesting. All right. And the monkeypox cases continue to rise in Colorado and really around the country. So as more kids and college students are heading back to class, is there any concern of an increase in cases there?
We always get concerned about an increase, especially when you have young folks getting together. But I don't think that anybody is really expecting to see an explosion of cases. It still is confined to a very specific group of people. But nonetheless, when it comes to kids, there are several age groups you need to think about when it comes to concern over monkeypox, which once again, it really is a low level of concern, but there needs to be a level of awareness. Now, let's say you have a kid in daycare. You want to make sure, particularly when it comes to things like toys, there are people who are doing diaper changes, there's close contact, so on and so forth that's going on there. You want to make sure that there really is good hygiene being followed, disinfection of toys and so forth in those particular circumstances. Then when you get into grade school age children, the concern is even less. There have been very, very few cases of monkeypox in that age group, and those cases we believe are actually household related, not from being outside of the household. So the concern there is a little bit less. Now let's take a look at middle schoolers and high schoolers. I think it's time for parents to be chatting with their kids about things. Certainly it is a time to have, the talk just in general, but when it comes to things like monkeypox, things like kissing, close contact, those are things that just need to come into the conversation for parents when it comes to kids. Also in this age group, a lot of people are saying, well, what about sports? What about athletics? What about sharing things? What about kids who wrestle, for example? The typical routine things that have been going on for years in terms of disinfection and protection against those other diseases that typically can be spread through athletic competition and so forth. Those are already in place, and so the concern level there, not that big. Now let's move on to college. Colleges are really being very proactive at this point in time. We do get concerned about the fact that there are those who have multiple sexual contact. We do get concerned about the gay and bisexual population. And so there really does need to be a level of awareness there in terms of what's available in terms of treatment as well as vaccination. I think the main takeaways at this point in time, once again, this is not something that is exploding everywhere. I don't think on an everyday basis, people need to be very concerned that they're going to pick it up through just casual contact, going to the grocery store, going to the gym, and so forth. And I think that it's really important, too, to emphasize the fact that if there is anyone, adult or child, who is ill or is ill and has a rash, that is something that definitely requires isolation, definitely requires an examination by a healthcare professional in order to make a determination whether monkeypox is even something that needs to be considered, and it should be.
Yeah, well, thank you, Dr. Dave, for all of your advice. It's always so interesting to talk to you. We appreciate it.
You're welcome.
And you can catch all of our Q&A with Dr. Dave segments at cbscolorado.com.